coming back.
Yes, welcome back.
Yes. I am Dr. Tisha.
And I am Dr. Tracy. And we
are
are Mahogany Mindset. Yes. Thank you for coming back. We would love for y'all to like, subscribe, and share our videos.
And thank you so much to everyone who has already liked,
subscribed, and shared. We appreciate all the support we have had so far. We really do appreciate it.
Felt the love.
We have felt the love.
We felt the love.
And the need.
Yes. Everybody the need. Yes.
Hey, everybody need a little mental health break.
Absolutely. And once again, get in the comments.
Yes.
Let us know what you want to talk about.
Let us know what you want to talk about.
What you're excited about. And what we're going to talk about today?
We're going to talk about Tourette syndrome because we try to keep our topics to something that's in the news. Or in the know that's going on right now that affects your lives currently. But we're also going to go back and talk about things that may be happening in your life throughout your life. So we're going to go back and forth. Stuff. Real life, real people, real discussions. So we're going to do all the things that encompass mental health, including
back and forth,
back, forth and forth. Let me see you. We swear we can sing. We can sing enough to be dangerous. But today, I know many of you all saw the award ceremony where there was a real life example of a person living with Tourette syndrome. And some of the things he said were offensive. Made him uncomfortable. And we want to talk about Tourette syndrome because that is a mental health diagnosis that people live with. It's real life experience people are living with daily. Absolutely. We're going to have some videos inserted to explain more about Tourette syndrome, but we're also going to give some facts and statistics about it and give our clinical diagnosis of it, some examples of clinical diagnosis of it, and our opinions about it also. Our scientific opinions. Our clinical opinions about the disease state because we are trained professionals, so we do have opinions about it.
And so we'll kind of tell you what the signs and symptoms are, how you are diagnosed with it, who can diagnose it, and we'll talk about, like you said, some opinions, and is it clinical or was it conspiracy?
Yes, people have different opinions about. Really, absolutely. Is it a disease state that can be clinically diagnosed, or is it something else? I don't know.
So we'll talk about it.
Our mental health is such a hard thing to treat versus like a medical diagnosis. It's not a lot of tests that you can do for mental health. It's very subjective to the practitioner who is diagnosing with it. So it's good to have different opinions about things. If you have questions about your mental health, you can get different opinions. Second opinions about this. Is a little side note. Yes, it is a science, and science has to be tested. So
absolutely.
Get 2 or 3 diagnoses if you're not sure. But yes, back to Tourette's syndrome. And I'm gonna let our clinical nurse practitioner talk about some of these diagnoses. Criteria.
So the first thing that I went to, of course, because this is what mostly governs my clinical practice, is the DSM-5. And so this manual is a diagnostic standard manual that helps you to find the criteria for a lot of different mental health diagnoses.
And it's based on clinical trials. Most of the diagnoses for all these mental health disorders are based on clinical trials.
So to receive a Tourette's diagnosis, there are a list of criteria that you should meet. And so the first one is multiple motor and vocal tics as well. Some people do not have them at the same time, but both of them are necessary.
And some of them present at first and then they all come together. So it can be numerous things that come up. We usually video of it also. We're insert videos of it also.
And the symptoms must begin before they turn 18.
18. Yes,
so
you have because a lot of childhood diagnosis.
Yeah,
I saw that in the video.
Childhood, adolescence. So that's usually when it comes in. Now, of course, as with any diagnosis, you must rule things out.
Yes.
Okay.
Comorbidities associated with Tourette syndrome. Yes, I read that too.
Yeah. And the tics, they could be better associated or attributed to other things. It could be substances.
Right.
It could be other medical conditions because there's a lot of different motor and tic disorders.
Right.
It could be medications
as
well.
Because a lot of medications cause different movement disorders. A lot of antipsychotics and some antidepressants and histamines can cause some movement disorders too. So you have to rule all those out before you can make a differential diagnosis of Tourette syndrome.
Absolutely. And it has to persist over a year.
Over a year. So just remember all that.
Yes.
Under the age of 18, first clinical presentation of it, and duration over a year.
Yes.
And ruling out other factors of it. But they might have comorbidities such as OCD, obsessive compulsive disorder, or ADHD. ADHD could be associated with Tourette syndrome.
And comorbid, if you don't know, comorbid happens at the same time.
Yes. So you can have ADHD and Tourette syndrome at the same time, or you can have ADHD and OCD at the same time. So yes,
depression,
anxiety,
all of that
can be together
with
so your job is very hard.
Tell me about it.
Yes, your job is very hard.
So I'm not the only person though. Like there could be a neurologist. I always suggest going to a neurologist because I feel like they're more specialized with neurology.
Right. And you may need a physical examination too, along with your mental examination. You may have to get an MRI, a CT scan of your brain. It could be caused by a head injury, something like that. So anything, when you knock your head, your brain is very fragile. Even though it's surrounded by a very hard thing called a skull, if you injure your brain, it can cause a lot of neurons to synapse incorrectly, which can cause some motor functionalities to alter and also some mental functionalities to alter. So just be aware of that too when you're thinking about that.
And like you said, there has to be a physical exam. There's really no test. Like you can't draw blood just to get this diagnosis. Of course, they will draw blood just to make sure that nothing else is going on.
Because anytime you are seeing a practitioner, you need a baseline.
Absolutely.
Because it could worsen or get better, but you can't tell unless you get a baseline. That's not a tidbit we're gonna throw it in for y'all. We throw little tidbits every once in a while, just get y'all a baseline of our knowledge.
There you go.
go.
I mean, even though there's no test, sometimes it can be treated. Everybody don't want medication, but it can be treated with benzodiazepines, like your Valium, all the things that we don't want to prescribe.
Ativan.
Yes. And it could be some blood pressure medications, particularly like beta blockers. Off-label. Anti-anxiety meds, antidepressants. A lot of times we treat the comorbidities, and that can help.
Because sometimes the comorbidities can cause the Tourette syndrome to flare or be active more if you don't treat the comorbidities like OCD and ADHD. And those comorbidities, if you correct me, can be treated easier than just treating Tourette syndrome. Okay. Yes,
definitely. And as you can see, and we'll show you some examples of people who have Tourette's. There's a wonderful young lady that I watch and follow all the time on social media, and she's so beautiful. And she talks about how her episodes flare when she's like stressed.
Her name's Shay. Shay with love or Shay with a heart.
There are other conditions that causes tics. However, with Tourette syndrome, these tics are going to be lifelong, permanent. My name is Bobby. I like to party. If you don't believe me, mommy shake my body. Oh, that's really painful.
Yes, she so willing to show her life to the public, which is very brave of her to do that, because it's brave to show any of your life to the public. So to open your world up to someone is very brave. So it's very brave of her to show what how she lives with Tourette syndrome and what it may look like to people, so they can have a better understanding of it and be more acceptable or try to be more acceptable, take away the stigma of it that comes with it. Yeah. That's what we're trying to do now with this mental health. There is a stigma with mental health crises and disorders that makes it hard to live with for people. So everybody is sometimes has something going on with their mental health, and we just want to make it better to live with the world.
Absolutely. Yeah. And I always say, everybody, you can sit on the couch every now and then.
Yes.
And talk to somebody. Okay. Even with Tourette's.
Yes.
You know,
sit on that lady couch. Or that man, but there's sit on that lady couch. Therapy ain't never hurt nobody. Little therapy ain't never hurt nobody.
No, but it's very yes. I never say never.
Okay.
But it is very
majority of time. Allegedly. Allegedly.
Yes. But I've seen it help.
It has helped.
It
helped me. I have been through therapy.
Listen.
It's helped me.
I'm in it now.
So this therapy, if you need some help, go sit on that lady couch. That's all I got to say.
Listen. Go to your insurance company. Ask them who's in your network.
Yes. Co-pay.
In your neighborhood.
Don't be ashamed. That's all I can say. Take away the stigma. We want to take away the stigma and make it where you are comfortable discussing how you feel. It is okay not to be okay.
Okay. Okay. So we're going to run it back a little bit.
Circle back.
So the alleged outburst.
Oh, yeah. The outburst. The alleged outburst.
So what we've known with research is that only happens to about 10% of people who have Tourette.
Yes, the vulgar outbursts, because they do have tics that are involuntary tics. Because the tics are involuntary, by the way. This is supposed to be something like a part of your brain that you can't control yourself. So it's involuntary. That's why they are saying that this is a word ceremony. He apologized because it was involuntary. And this is where it comes from because, and it's called, what's the word?
So it's coprolalia. If I'm saying it correctly, let me know if I'm not.
Coprolalia.
And a lot of people who Tourette say that it's not something that's just something that you believe, something that you feel and just comes out. It's just impulsive.
Yes.
Yeah.
So
it's subconscious. Not like he was thinking about it. Allegedly.
And we don't know.
Allegedly.
Because we're not in people's brains.
Yeah.
We're just saying
we're
that 10%.
There. I've never spoken to him.
Don't know this man.
Yes.
We don't know this man.
No. We don't know him.
We don't know this man. But we want to show that people live with this. I don't know how many. If we're gonna show a video, how many people do live with this syndrome throughout the world?
Yeah.
And I mean, it is prevalent. So we just want people to know that it is out there, and it's not something they did for TV. Right. Because a lot of people think it's fake. Hollywood may be fake. Yeah. I don't know. And but that syndrome is fake. The syndrome is real.
But it's a very small percentage of people who actually have those vulgar outbursts.
Yeah. Around 1 in 100 to 1 in 1,000 people worldwide may suffer from Tourette's. A study of 3,500 patients in 22 countries suggested that men are 4.3 times more likely than women to be given the diagnosis. The average age of onset is thought to be around 6 years old, and research from the Yale Child Study Center that followed 36 young patients throughout their childhood placed the peak of tic severity at around age 10. By the age of 18, nearly half of the patients involved in that study were basically tic-free. An intrusive illness to have when it comes to everyday life. A study from Canada conducted in the 1980s found that 40% of respondents had problems with dating, making friends, and keeping either kind of relationship.
In research as well, we see that it goes all the way back to the 1400s.
Ooh, and back then they treated things very differently.
Differently. And some people think like that now.
Yes, they do.
Because they think it's the demon.
They do think it's a demon. Some people do think it's a demon inside of people who's causing this. These are your beliefs.
Because people have a few.
Yeah, a few. If you go to church, hallelujah. If you go to church, you may have seen where Jesus cast out demons and put them into swine. And so some people think religion is just a devil.
Yeah.
But then some people believe there are demons that possess people. So it just depends on your belief system. But that's one of the thought processes of Tourette's.
Yeah. And I think that that's probably why, because the earliest accounts were priests.
Yeah, they were
that
priests.
were actually having these movements, tics, outbursts, and so they just assumed that it was demonic.
Yeah, demon
witchcraft.
possession.
Yeah,
yes,
yeah, absolutely.
Witchcraft that caused the outburst and irregular movements. And over time, with sophistication of diagnoses and things, they figured out it's actual syndrome that's caused by. It's an unknown cause of it.
It's really unknown.
It's unknown what causes it. So it could be hereditary.
It could be very much so hereditary.
Or it can be physical. Like physical harm to your brain could cause it to come about. So
or developmental. Maybe it's something in your prefrontal cortex. All these things.
These are
that
theories.
Are in charge of
right.
your inhibitions.
Yes.
You know, it is kind of it does not develop correctly. So but we don't know. We think we know.
We think we know.
Yeah.
I think over time they figured out that some treatments work, and so keep treating that, and that. But every day they come up with new medications that can treat different disorders. So yeah, I mean, maybe one day we can cure everything. Yeah, hopefully. Hopefully, everybody can just. I don't know what normal is, but whatever your normal is,
your normal
is normal. I don't know what a normal is, but like whatever makes you happy in life, what makes you comfortable, that's your normal.
Absolutely.
Do your normal.
And we're going to put on the screen, also in the comments, there's a lot of great resources.
Yes.
Places that we went to look and research our own clinical experiences as well.
Yes.
But just go do your own research.
Yes.
Go look it up. We just want to bring awareness. We are not diagnosing you.
No.
We are not your doctors.
We are not your doctors.
But we are doctors in your spirit.
Yes. We're here to your spirit guides. Your doctoral guys through the mental health universe. Hey, I like that. That's cute. Okay. We want to say some resources. I know we are still. It's okay.
But
it's okay to laugh.
Yeah.
Whatever makes you feel good. If this video makes you feel good, play it
a lot going
over and over again.
Laughter is good medicine.
Good for the
heart and the soul.
Are we gonna say some of the resources, or we're gonna just show them on the screen?
Yeah,
we're gonna say the resources. The resources are here.
Here's
the
resources are somewhere
on the screen. There you go, pop. Resources.
But we'll put them in the comments as well.
Yes.
So look it up, do your own research. Again, get in the comments. Tell us what you think.
What do you think?
I think we're even gonna put a poll.
Yeah, we're gonna put a poll to see
tell us
what you think it is.
What are your thoughts? Do you think it's clinical
or conspiracy? Either way, we do not want to demonize anyone who is living with this syndrome. Tourette syndrome, I'm assuming it's very hard to live with. Shay has showed us some of the things she has to deal with. So
much love and respect for her.
Yes. So I'm assuming any mental health disorder is hard to live with. So we just want to give empathy and compassion to anyone who has a lived experience with these disorders. So
and education can bring empathy. Like if you don't know what's going on, then you can't help people. You can show them love, compassion.
Yes.
So just educate yourself. That's all we do.
That's all we doing. That's what we're here for. Educating you. And educating ourselves too, because they ain't never hurt nobody. That brush ain't hurt nobody. Ain't nobody. Jesus, ain't nobody. Do me like the Lord.
Thank y'all so much. We're so silly.
We are.
Look, I hope you like our cute little merch. It's coming. Don't worry. To a home near you.
And our little sayings gonna be in there. Yes, so we love some sayings. We love the love
shirts,
all the things. But let's remember to share,
please,
like, and subscribe, so the world can see us.
The world
needs us. They need us. I think they need us more. Yes. What the world needs now is love, sweet love.
We think our next episode we're gonna try to come to you with some tips about how to
cope. On the next episode, we're gonna come with some tips on how to cope with things you cannot control. Oh Lord, that make it shout right there because We cannot. We wish we control everything,
Listen.
but the world is kind of bonkers right now. It's a lot going on. It's sweet love. It's the only thing that there's just too little. Okay, that's the word.
Yeah, we got the word back on.
We make up words for everything. First of all.
All right. Peace out, y'all. Love you.
Love you.
Bye.